Jennifer Makarov here today. I have this glass board. I'm going to talk to you about IUI. So fertility facts, what is IUI? So it's spelled IUI, and that stands for Intrauterine Insemination. So let me talk about who might need that. So this is often the first step in a fertility treatment, and we start this for couples under age 35 who've been maybe trying for a year and weren't able to get pregnant, or over 35, you've been trying for 6 months. That's sometimes our first treatment that we consider is called IUI. Over age 40, sometimes we move more quickly to IVF because fertility is more fragile over age 40. So, you know, if you've been trying that long and haven't gotten pregnant, you want to go in and see your doctor and see if this is a treatment that you might be eligible for. So what exactly is IUI? Let me try and draw a picture here of a uterus. And these are fallopian tubes here. Top of the uterus, the fallopian tubes, this glass board, and then you have your ovaries out here. So every month, as you know, you release one egg, and the egg can be fertilized for about 12 to 24 hours. So part of the IUI is pinpointing the time of ovulation. So we get the sperm close to the egg right when it can be fertilized. So this is a very short time each month. So before we do an IUI, we actually do ultrasounds to check so we know exactly when the egg is ovulating. Sometimes you can take some medication ahead of IUI, a pill like Clomid or letrozole, to increase the chance of IUI success. And every cycle of IUI, the chance of pregnancy ranges from about 10 to 15% chance of pregnancy each cycle. And it doesn't level off until after 3 or 4 cycles of doing IUI. So to give it a fair chance to work, we usually say 3 cycles of IUI. So back to the ovaries here. So we're watching these with ultrasound, and you can see a follicle grow, which is a big circle of fluid. It looks on the ultrasound. And once we see that the egg is a good size on the ultrasound, sometimes you'll take a shot to trigger ovulation, which is called Ovidrel, and that triggers the release of the egg. The egg will be released about 36 hours later, so we know exactly when to do the IUI. And sperm can actually live for a few days inside the uterus and cervix here. So this is your cervix. So we can do, after you take Ovidrel, the next day and the following day, so about 12 hours and then 36 hours later, the IUI. So IUI, a male partner would give a sperm sample, and that's collected in the office, or can also be collected at home and then brought to the office, should get here within an hour or two. And then the sperm is washed, and the sperm is washed, and all the sperm that's swimming well is concentrated down. So you have all the sperm that's swimming well, and then it's like a thin tube is then, to do the IUI, a thin tube is placed into the uterus, and the sperm is placed right about here at the top of the uterus, again 12 or 36 hours after the Ovidrel, and the sperm very quickly within a few seconds basically is in the tube, and fertilization happens in the tube right here. So you're getting all the sperm really close to the egg, and with intercourse most of the sperm is lost. So this is part of what gives us a boost. We save all the sperm and get it really close to where the egg is, and it goes into both fallopian tubes here. After that, you know, you come back to the clinic in about 16 days, and we can do a pregnancy test. So you have that 2-week wait after the IUI. Immediately after the IUI, that day you can go back to normal activity, but you may have some cramping. Occasionally women get some spotting that's from the outside of the cervix right here. So these are some side effects you may notice after IUI. And what else to know? So IUI is also used by same-sex couples or a single woman who are using a donor sperm. They go through a similar process, and the donor sperm is thawed right before the IUI and placed at the top of the uterus. And so this concludes that fertility fact on IUI, and I'll see you next week for another fertility fact. Thank you.